All right, ever get one of those like really annoying
Yeah.
little red bumps on your eyelid?
Mm-hmm.
A stye.
Ooh.
So common. But like, we kind of just brush them off as a minor inconvenience.
Right.
Today, we are diving deep into styes.
Okay.
And to like guide us, we've got Professor Dr. Suhail Sarwar.
Excellent.
He's a leading eye surgeon
Oh, wow.
in Lahore, Pakistan.
Okay.
He's helped tons of patients with this.
Yeah.
So get ready.
Okay.
We're going to uncover some surprising facts about styes.
Stuff I bet you never knew.
Yeah.
It's wild how something so small can be so complex.
Yeah, that's what we're here to explore.
I love it.
But like before we get into all that,
Yeah.
what exactly is a stye?
Like in the most basic terms,
Yeah.
a stye or hordeolum, it's like a tiny little localized infection
Okay.
on your eyelid,
Okay.
like a pimple,
Oh, okay.
but on your eyelid.
Ouch.
Yeah, they can be super uncomfortable.
Yeah, I can imagine.
For sure.
And they can be painful too.
Oh, yeah.
What causes these little eyelid pimples to even form?
Well, the most common culprit is a bacteria called Staphylococcus aureus.
Ah, Staphylococcus aureus.
Yeah,
Yeah.
the one that sometimes causes those nasty staph infections.
Yeah.
It's actually pretty common.
Oh, really?
Yeah, it's found on our skin,
Oh.
even in our noses.
Oh, wow.
Most of the time, it's totally harmless.
Okay.
But sometimes it can, like, sneak into the oil glands in our eyelids, and then,
Oh, no.
yeah, and then we have problems.
So our eyelids have these tiny little oil wells, and sometimes bacteria just decide to set up shop.
You got it, exactly.
Yeah.
When that happens, things get inflamed,
Yeah.
painful, and that leads to that red bump.
That we all know and hate.
Yeah, exactly, the stye.
The dreaded stye.
The dreaded stye.
All right, so we've got bacteria to blame.
Yeah.
Are there any other things that make us more prone to getting them?
Mm.
Like, is it just bad luck or...
It's not just bad luck.
Okay.
There are definitely risk factors.
Okay, what are they?
Things like skin conditions,
Okay.
like seborrheic dermatitis or
Right.
having diabetes
Right.
can make you more susceptible. And believe it or not, even high cholesterol can play a role.
Wait, really?
I know.
High cholesterol?
Yeah.
I never would have thought that would be connected to eye infections.
It's true. It might sound surprising,
Yeah.
but high levels of certain fats in your blood,
Okay.
those are called serum lipids,
Right?
can actually affect like the composition of your tears,
Mm.
making your eyes more vulnerable to infections.
So it's all connected.
It really is. It's all connected.
Wow, that's fascinating.
Right.
It's a good reminder that
Yeah,
everything in our body is interconnected.
it really is.
So for all of our listeners out there,
Mm-hmm.
if you're dealing with high cholesterol,
Yeah,
this is just another reason to keep those levels in check.
absolutely.
Yeah,
Taking care of your overall health is a great way to take care of your eye health, too.
I like that. Okay, so let's talk symptoms.
Yeah.
So if someone's listening right now and they're like, maybe I have a stye,
Maybe.
what should they be looking out for?
Okay, well, you already hit on one of the key symptoms.
Which one?
Pain styes can be quite tender and sore.
Yeah.
And along with that, you'll typically see redness and swelling around the affected area.
Okay, so that classic red bump.
Exactly, right on the eyelid.
Right where you don't want it.
Ugh, I know, right?
Yeah.
Now, the location of that bump can vary if
Okay.
it's like right at the base of your eyelashes.
Yeah.
That usually means it's an external stye,
Okay.
meaning the infection's in the glands at the edge of your eyelid.
Okay.
But sometimes
Yeah.
it can develop inside the eyelid,
Oh,
deeper within,
wow.
involving the oil glands there.
Okay.
Those internal styes might not always have a visible bump.
Oh, interesting.
Yeah, but you'll definitely feel it.
It's like a hidden enemy. You know it's there,
Exactly.
but you can't always see it.
Exactly. But whether it's internal or external, the
Yeah.
symptoms are usually pretty similar.
Okay.
Pain, redness, swelling, tenderness.
So you know something's up.
You know something's up for sure.
All right, so let's say you've got all the classic stye symptoms.
Mhm.
What's the best way to deal with them?
Ooh, good question.
Is it just a waiting game?
So actually, most styes resolve on their own
Really?
with a little TLC and some patience.
Okay, so TLC, like warm compresses,
Yeah,
good hygiene.
you got it.
Okay.
Warm compresses are a classic remedy.
Yeah.
And for good reason.
Hmm.
They help to soften the blockage in the oil gland,
Okay.
encourage the pus to drain naturally.
My grandma always swore by those.
Your grandma was a wise woman.
Yeah, I think so.
It's simple but effective,
Yeah.
soothes inflammation, helps the stye heal,
Okay.
and of course, good hygiene is crucial.
Right.
Wash your hands frequently.
Yeah.
Avoid touching or rubbing your eyes.
Okay.
That can help prevent the infection from spreading or getting worse.
So treat your stye with the same care you would a cut or any other minor wound.
Exactly.
Keep it clean and give it time to heal.
Yeah. Now, if the stye is being particularly stubborn,
Uh-huh.
yeah,
And it doesn't seem to be improving with those at-home remedies?
yeah, your doctor might prescribe some antibiotic ointments or drops.
Okay.
Those can help kill the bacteria
Okay.
and speed up the healing process.
A little extra firepower.
Exactly.
All right, so in rare cases,
Yeah,
if it's an internal side that just won't budge?
it happens.
Yeah.
You might need a small surgical incision to drain it.
Whoa, okay, surgery for a stye?
Yeah.
That sounds a bit extreme.
It is. It's not the first line of treatment,
Right.
but in some situations, it can provide relief and prevent complications.
Okay, so are there any, serious risks associated with styes?
That's a great question.
Yeah.
And it kind of leads us to one of the most fascinating aspects of our deep dive today.
Ooh, okay.
Sometimes
Yeah.
what appears to be a simple stye can actually be a sign of something else entirely.
Whoa, okay.
Right.
So a stye can be more than meets the eye.
Exactly. Exactly.
Okay, give us an example.
All right. So there was this case study
Yeah.
about a 5-year-old boy
Okay.
who was initially diagnosed with a stye,
Okay.
but it just wouldn't go away,
Oh, no.
no matter what they tried.
Oh, wow.
Turns out it wasn't a stye at all.
What was it?
It was something called an eschar,
An eschar.
caused by a bacterial infection called scrub typhus.
Scrub typhus. That sounds serious.
It can be, yeah.
Okay.
It's spread by mites,
Okay.
and it's most commonly found in parts of Asia, Australia, and the Pacific Islands.
Got it.
And one of the symptoms
Yeah.
is this black scab
Okay.
called an eschar.
Right.
And in this boy's case,
Yeah.
it formed on his eyelid,
Oh, wow.
mimicking a stye.
So it was like a medical disguise.
Totally.
The scrub typhus was hiding?
It was hiding, yeah.
Wow.
And that's why it's so important to seek medical attention. If a stye doesn't respond to the usual treatments,
Right.
or if it's accompanied by other unusual symptoms,
Okay.
like fever or rash,
Okay.
it could be a sign that something else is going on.
Yeah, so even if you think it's just a stye,
Yeah.
it's always better to err on the side of caution.
Absolutely.
Yes.
And get it checked out by a doctor,
Yeah, good point.
especially if it's not improving.
Right.
And,
Yeah.
there are other conditions that can sometimes mimic a stye,
Okay.
like a chalazion.
A chalazion.
Yeah, that's when an oil gland gets blocked,
Okay.
but it's not actually infected.
Hmm.
So it's more of like a hard, painless lump.
Okay, so it's important to be aware of these other possibilities.
It is.
And I'm guessing a doctor would be able to tell the difference between all of these.
Oh, absolutely, yeah.
Okay.
They can properly diagnose the condition
Right.
and recommend the best treatment plan.
Okay, no more self-diagnosing with Dr. Google.
No, Dr. Google.
I've learned my lesson. But going back to the cellular level for a moment,
Okay.
we've been talking about those oil glands.
Yeah.
But what about the bacteria themselves? What are those little troublemakers actually doing in there?
Oh, that's fascinating.
Yeah.
So bacteria like Staphylococcus aureus are remarkably adaptable. They have all these survival strategies,
Right.
and they can thrive in all sorts of environments, even those tiny little oil glands.
So even a tiny oil gland can become a bacterial breeding ground.
It's true.
Oh, no.
And once they've set up camp,
yeah.
they release toxins
Wow.
that damage the surrounding tissue.
So that's what causes all the pain.
Yeah, and it fuels that inflammatory response.
No wonder styes are so painful.
I know, right?
It's like a bacterial war zone happening right on your eyelid.
It really is. And remember, this is all happening on a microscopic scale.
Right. Wow.
It's pretty incredible.
Yeah.
It's a testament to the complexity and power of both our immune system and the microorganisms that inhabit our bodies.
It's amazing to think about
Right.
that we're like walking ecosystems,
Yeah.
constantly battling these unseen forces.
It's a constant battle.
Right.
And understanding these intricate interactions
Yeah.
can help us appreciate the delicate balance
Right.
between our bodies and the microbial world.
Okay, so we've taken a macro view of styes,
Right.
causes, symptoms, different types,
Yeah.
and now we've explored the micro view,
We have.
what's happening at the cellular and bacterial level.
We've zoomed right in
Yeah.
to that
Yeah.
microscopic world.
Exactly, and now I'm curious.
Yeah.
How does this knowledge translate into prevention?
Oh, good question.
What can we do to minimize our chances of getting these pesky styes in the first place?
I'm happy to share some tips.
Okay, great.
Let's dive in. Okay, so let's zoom in
Okay.
and take a microscopic look
Ooh, I like it.
at how a stye actually forms.
Microscopic mayhem. I'm all for it.
All right, so picture
Yeah.
those tiny oil glands in your eyelids. But they're like little factories, constantly churning out oil to keep your eyelids lubricated.
That's right.
And to keep your tears from drying out.
So they're important.
They're very important.
Okay.
So now imagine one of these little factories gets clogged. That's the first step in stye development.
Okay.
Could be a buildup of like dead skin cells, too much oil.
Okay.
Or, if bacteria are involved,
right,
a clump of those Staphylococcus aureus troublemakers.
That's when the real drama begins.
That's when the party starts.
Okay.
So the bacteria start multiplying.
Oh.
And that triggers your body's immune system
to
jump into action.
Okay.
It's like sending out an SOS signal.
Right.
And your body responds by sending white blood cells to the scene,
Okay.
ready to fight off the invaders.
So it's like a microscopic battle going on.
It is a microscopic battle.
Right there in my eyelid.
Right there in your eyelid.
Wow.
White blood cells versus bacteria.
So what happens?
As this battle rages, the area becomes inflamed.
Okay.
The blood vessels dilate.
Okay.
Which causes the redness and the swelling. And then fluids and pus start to accumulate.
That's not good.
And that creates that painful bump we know as a stye.
So the stye itself is like a side effect.
It is, yeah.
Of the body's defense mechanism.
It's your body trying to contain the infection.
Okay.
Prevent it from spreading.
It's trying to protect me.
Exactly. It's like your body building a wall.
Wow, I like that analogy.
Around those invaders.
Yeah.
To keep them from taking over the whole eyelid.
Okay, that makes sense.
Good.
What about the cases where a stye isn't caused by an infection?
Right.
Like sometimes it's a chelation.
Ah, good point.
Right.
Chalasia are a bit different.
Okay.
They're not infections, but rather a chronic inflammation of those same oil glands.
So no bacteria involved?
Not usually. Instead of an acute bacterial invasion, it's more of a slow, steady blockage that builds up over time.
Okay.
Think of it like a drain slowly getting clogged with debris.
I can picture that.
Yeah, and that eventually leads to inflammation.
But it's different from the infection inflammation.
It is different, yeah.
Okay.
It's typically less intense, less painful.
Okay.
And there's usually no pus involved.
So a chelation is more like a firm, painless lump.
Exactly.
Okay. And since it's not an infection, warm compresses might not be as effective.
They might not be.
Okay.
Sometimes you might need steroid injections.
Oh, wow.
Or even a minor surgical procedure to clear that blockage.
That makes sense.
Yeah.
That explains why my grandma's warm compress trick didn't work for my friend's chelation.
Right. It's a common misconception.
Yeah.
People think that any bump on the eyelid is a stye.
Right.
But knowing the difference is key to getting the right treatment.
Good point. So it sounds like a doctor can tell the difference pretty easily.
Absolutely.
Okay, good.
Yeah.
So going back to the cellular level, we've been talking about the oil glands.
Yes.
But what about the bacteria themselves?
Oh, that's a great point.
What are they doing in there?
Okay, so bacteria like Staphylococcus aureus are remarkably adaptable. They have all their own survival strategies. And they can thrive in all sorts of environments.
Wow.
Even those tiny oil glands.
So even a tiny oil gland can become like a bacterial breeding ground.
It's true.
Oh, no.
And once they've established themselves, they release toxins that can damage the surrounding tissues, which further fuels the inflammatory response.
So that it's a double whammy.
It is a double whammy.
That's why styes are so painful.
Makes sense, right?
Yeah.
And remember, this is all happening on a microscopic scale.
Right.
It's really a testament to the complexity and power of both our immune system and the microorganisms
that live inside us.
Yeah, that inhabit our bodies.
Wow, it's amazing to think about.
I know.
We're like walking ecosystems.
We are constantly battling these unseen forces.
That's why.
And understanding these intricate interactions can help us appreciate the delicate balance that exists between our bodies and this microbial world.
So we've taken that macro view of size.
Right.
Causes, symptoms, the different types.
Yeah.
Now we've explored the micro view.
We have.
What's happening at the cellular and bacterial level.
That microscopic world.
What I'm curious about now
is
how does this knowledge translate into prevention?
Good question.
What can we do to minimize our chances of getting these pesky styes in the first place?
It's all about being proactive.
Okay, so how do we keep those microscopic battlefields from erupting on our eyelids?
Yeah, good question.
What's the secret?
The good news is prevention is often easier than you think.
Okay, good.
A lot of it comes down to simple, everyday habits.
Okay, give us the rundown.
All right, first and foremost,
Yeah.
hygiene is your best friend.
Yeah, I've heard that.
I know it sounds basic,
Yeah.
but washing your hands frequently,
Right.
especially before touching your face or eyes,
Okay.
can make a huge difference.
So keep those Staphylococcus aureus bacteria
Yeah, keep them away
from my eyelids.
Exactly.
Okay.
And don't forget about your makeup brushes and applicators.
Oh, right.
Those can harbor bacteria too.
Yeah, I'm probably guilty of neglecting that step.
Yeah, we've all been there.
Yeah.
It's easy to overlook,
Mm-hmm.
but it can really make a difference.
Okay, what else?
Another important tip.
Yeah.
Avoid sharing eye makeup or towels.
Right? Okay.
Again, it's all about minimizing the spread of bacteria.
So no more borrowing mascara.
Probably a good idea.
Yeah.
And if you wear contact lenses,
Yeah?
be super diligent about cleaning and disinfecting them
Okay.
properly. Follow your eye doctor's instructions.
Right, no cutting corner.
No cutting corner.
Contact lens hygiene, that's a whole other
It is.
deep dive.
We could do a whole episode on that.
Yeah, we should add that to our list.
Okay, I'll put it on the list.
All right, good.
Now, beyond hygiene,
Yeah.
there are a few other things you can do.
Totally.
Like if you have blepharitis,
Right.
that chronic inflammation of the eyelids.
Remind me what that is again?
So blepharitis is basically
Yeah.
when the oil glands in your eyelids
Okay.
get inflamed
Yeah.
and they don't function as they should.
Right.
This can create a perfect breeding ground for bacteria,
Oh.
making you more susceptible to styes.
So it's like tackling the root cause.
Exactly.
Get that blepharitis under control.
Yeah.
And you're less likely to get those styes.
You got it.
Okay.
Your eye doctor can recommend various treatments,
Okay.
like warm compresses, special lid scrubs, antibiotic ointments
Okay.
to help manage blepharitis
Okay.
and keep those styes away.
Okay, so we've got good hygiene,
Mm-hmm.
clean makeup tools,
Mhm.
no sharing, managing any underlying conditions.
Yeah, like blepharitis.
Like blepharitis.
Exactly.
Okay. And of course, if you do get a stye,
Yeah.
don't squeeze or pop it.
Resist the urge.
I know it's tempting.
It is, but it can make things worse.
Right.
So stick to the warm compresses.
Okay.
Maintain good hygiene.
Mm-hmm.
And if it's not getting better,
Yeah.
or if you have any concerns,
Right.
see your doctor.
Okay, solid advice.
With it.
So it sounds like preventing styes
Yeah.
really comes down to
Being proactive.
being proactive.
Taking care of our eye health.
Right.
Just like any aspect of our well-being.
Mhm.
A little knowledge and some simple preventative measures can go a long way.
You know, it's funny. We started this deep dive
Yeah.
talking about those annoying little bumps on our eyelids.
Right.
But we've uncovered so much more.
We have.
It's been a journey.
It has.
Bacterial battles.
I know, right?
Surprising connections to other conditions.
Yeah.
Ancient practices like bloodletting.
Who knew?
It's incredible how much complexity lies
Yeah.
beneath the surface.
Yeah.
Of something seemingly so simple.
It's a good reminder that our bodies are these amazing, intricate machines.
Right.
Even the most commonplace ailments
Right.
can offer a window into this fascinating world of medicine.
I think we've given our listeners a lot to think about today.
I think we have too.
But before we wrap up,
Yeah.
I've got one final thought.
Okay.
We talked about bloodletting
Yeah.
as a traditional treatment
As an ancient treatment for styes.
for styes.
Yeah.
And I know it might sound strange,
Yeah.
maybe a little scary to some people,
Right.
but it raises an interesting question.
What's that?
What other traditional remedies or practices might hold some hidden potential in modern medicine?
I love that.
What ancient techniques have we dismissed too quickly?
That is such a great question to ponder.
Right.
It reminds us to approach new information with curiosity and an open mind.
Right.
Who knows what breakthroughs might be waiting to be rediscovered?
So to our listener,
Yeah.
I challenge you, do a little research.
Yes.
Dive into the history of traditional medicine.
It's fascinating.
You might be surprised by what you find.
You never know.
You might even uncover the next big medical breakthrough.
That's the beauty of knowledge. It's
Yeah.
an endless journey of exploration and discovery.
Well said.
Thank you.
Thanks for joining me on this deep dive
Oh, of course. It was my pleasure.
into the world of styes.
Yeah, styes. Who knew?
It's been an eye-opening experience.
I couldn't resist.
Pun intended.
I had to.
All right, until next time,
Yeah.
stay curious
Stay curious.
and keep those eyelids healthy.
Keep those eyelids healthy.